HSE CEO Bernard Gloster is seeking the introduction of a permanent new 7-day working roster for all hospital staff in the forthcoming public sector pay talks. Many health professionals, such as nurses, work on a roster that does cover 7 days a week, but other key hospital staff, such as radiographers, generally work Monday to Friday. And Gloster is writing to all hospital staff to ask them, I don't know how this is going to go, to volunteer for a 7-day working roster to reduce overcrowding in emergency departments.
Good luck with that.
I know, and I did it myself. I worked in weekends in hospitals, and I know that nurses and doctors do, but bear in mind, it is still a skeleton staff compared to the full staff that are on at the weekend.
Yeah.
So 5 days a week, the hospital runs at full tilt.
You're not getting your scans and all that
7
kind of stuff
days
at
a
the
week.
weekend.
Other stuff happens to some extent, emergency stuff and maintenance stuff. But the bulk of hospital work does not occur over 7 days. It occurs over 5 days. If we change that to keeping it running full tilt for 7 days, we would see huge changes to our waiting list. But the thing about it is in a way, I think they should have done this years ago when people wanted these jobs. Because if you say to people now working in hospitals, oh, you should work 7 days, they don't want to, because they're already burnt out. They're already sick of it. And actually, the terms and conditions that they have, which are... they will not agree that they are good, but they don't have to do these types of things necessarily. The terms and conditions that they've had have made the system worse, made the system harder to work in, and they don't want to work in it, and they don't want to do any more. But actually, something has to give to make it better overall. Yeah. I think this is a good idea, but I think there is so little trust on the parts of healthcare workers for the HSE that trying to bring them with the HSE is going to be incredibly difficult. I think the public service is run largely for people who work within it rather than... I think we're moving in healthcare in a patient-centric way, so it's not the worst of it. But I think we should focus in education on being student and child-centric. I think it should be patient-centric in healthcare. I think public services should be run for the public. And I think that other than that, public sector unions are socialists without a social conscience.